Hello everyone. Today we will discuss about it that is hypolipidemic drug. Okay, it is basically consist of two terms, hypolipidemic. That means that the drug that increasing the lipid level. So when the lipid level increases in a disease called hyperlipidemia. So what is hyperlipidemia? Hyperlipidemia means increase in lipoprotein. Okay, this hyperlipid basically of two types. One is atherosclerosis, another one is acute pancreatitis. Okay, so what do we mean by atherosclerosis? There is a formation of atheroma in blood vessels. ओके, ब्लड वेसल्स में आर्थेरोमा फॉर्मेशन को हम आर्थेरोस्क्लेरोसिस बोलते हैं. सो इसका एग्जांपल मैं आपको समझाता हूं. लाइक एग्जांपल दैट इज कोरोनरी आर्टरी. लेट अस इट इज अ कोरोनरी आर्टरी. ओके, if there is a formation of atheroma in this coronary artery, what do basically coronary artery do? Coronary arteries are the type of arteries that supply oxygenated blood to heart. Okay, heart matlab heart muscles, cardiomyocytes. If this artery get blocked, the supply of oxygen to the cardiomyocyte decrease. If atheroma is formed, decrease in blood supply to cardiomyocytes. Okay, due to this, hypoxia develop, and you know that due to the hypoxia there is subcardiac cardiomyocyte. That eventually leads to myocardial infarction. Okay, and second thing is, what is this atheroma means, or how this, what are the composition of this atheroma? Okay, the atheroma basically consists of few things like foam cells, fibrin, collagen, calcium. Okay, all these things are the composition of this atheroma. Okay, when this atheroma breaks, that leads to activation of platelet. And I discussed you that how this takes place. I have discussed you people in the last video. Due to this activation of platelet, there is a formation of thrombus, and this thrombus formation leads to several pathological conditions like cerebrovascular disease, coronary artery disease, stroke. Such type of pathological condition develop. So here culprit factor is lipoprotein. Okay, so now we will discuss about what is this lipoprotein. Okay, lipoproteins are Lipoproteins are consist of triglycerides or cholesterol ester in core, which is surrounded by an outer layer that made of up of phospholipids. किससे बनता है? Phospholipid, free cholesterol, then apoprotein. These are the composition of outer layer and this is the composition of the core. Okay, now we'll discuss about the different type of lipoprotein. Okay, this lipoprotein basically of 6 type. Basically of 6 types. Okay, क्या क्या है? Chylomicron, ruminant, then very low density lipoprotein, intermediate density lipoprotein, low density lipoprotein and high density lipoprotein. So what is this function of this type of lipoprotein? This chylomicron and chylomicron remnant helps in dietary ट्राइग्लिसराइड ट्रांसपोर्ट. जो हमारे खाने में जो ट्राइग्लिसराइड्स रहते हैं उसको ट्रांसपोर्ट करने का काम ये करता है काइलोमाइक्रॉन एंड काइलोमाइक्रॉन रेमिनेंट. ओके, VLDL, what is it to it? A endogenous transport of triglyceride. जो एंडोजेनियसली ट्राइग्लिसराइड बनता है उसका ट्रांसपोर्ट करता है हमारा VLDL. What is IDL do? Transport cholesterol ester and triglyceride to liver. What LDL do? Transport cholesterol to tissue and liver. लीवर एंड टिश्यू को जो कोलेस्ट्रॉल ट्रांसपोर्ट करने का काम ये एलडीएल करता है. एचडीएल क्या करता है? रिमूव करता है कोलेस्ट्रॉल फ्रॉम द टिश्यू. Okay, so one point, important point, that you should remember that this HDL cholesterol is called as good cholesterol because it removes the cholesterol from the tissue. Okay, now let us see how the cholesterol synthesis occurs. कोलेस्ट्रॉल कैसे सिंथेसिस होता है? First important thing is cholesterol synthesis takes place in the liver. If we draw a rough diagram of liver, or suppose this is a liver, how cholesterol synthesis takes place? We know that acetyl coenzyme है, it converts to mevalonic acid. So for the conversion of acetyl coenzyme A to mevalonic acid, one important enzyme participates, that is HMG coenzyme A reductase. Okay, then mevalonic acid converted to cholesterol. In the liver, the transfer of cholesterol from the liver to blood vessels. So suppose this is one of our blood vessels. For the transport of, so suppose these are our cholesterol molecule. For transport of cholesterol from the liver to blood vessels, there is um, a transporter, that is ApoB. ApoB that helps the transport of cholesterol into the blood vessels. Okay, transport of cholesterol into the blood vessels. So due to this, when there is a level of cholesterol or lipoproteins increase in the blood vessels, that leads to hyperlipidemia, and that leads to hyperlipidemia. So how we can prevent this condition, or how we can treat this condition? To treat this condition, there are several strategies are there. First important enzyme is this HMG coenzyme reductase. This enzyme is the rate limiting enzyme. This is the rate limiting enzyme in the cholesterol synthesis. So what do you mean by rate limiting enzyme? Rate limiting enzyme is the crucial step and the slowest step in a particular synthesis. So HMG coenzyme reductase is a rate limiting enzyme in the synthesis of cholesterol. So this HMG coenzyme can be inhibited by an important class of drugs, that is so these are the frequently or commonly used drugs of control of hyperlipidemia. So statins are of atorvastatin, lovastatin, rosuvastatin, pitavastatin, pravastatin, simvastatin. This atorvastatin is the commonly and more potent drug, which is basically used for different um, pathological condition that I will discuss in that particular section. Then this is one important class of drug. So second important class of drug is, and we know that bile acids are the transporter of cholesterol. Okay, so what we can do is we can inhibit this bile acid. So bile acid, to inhibiting this bile acid, so bile acid sequestrants are there. Bile acid sequestrants are there. These are chelating the bile acid, or by chelating the bile acid and inhibit the absorption of cholesterol. So drugs comes under this class is cholestyramine and cholestyramine. cholestyramine and cholestyramine. Okay, third important class is, what we can do is we can activate PPAR gamma. Sorry, PPAR alpha. We can activate PPAR alpha receptor. What does this PPAR alpha receptor do? We will discuss in that particular section. Drugs comes under this is gemfibrate, all the fibrate class of drug. Gemfibrozil, chlorfibrate, okay. Then benzafibrate, fenofibrate. And another important class of drugs is स्टेरॉल और डाइटरी कोलेस्ट्रॉल, जो कोलेस्ट्रॉल हमारे खाने में प्रेजेंट होता है उसका अब्जॉर्प्शन हम इनहिबिट कर देंगे. डाइटरी कोलेस्टेरॉल absorption inhibitor. This is an important drug, that is ezetimibe. Another one important class drug is lipoprotein lipase inhibitor. Nicotinic acid. Okay, so these are the class of drugs that is used for the treatment of hyperlipidemia conditions. Okay, so we will discuss one by one of each class of drug. Let us start with HMG coenzyme reductase inhibitor, or commonly known as statins. Let us discuss about statins. So statins are inhibit HMG coenzyme reductase enzyme, which is a rate limiting enzyme for the synthesis of cholesterol. Due to this inhibition of HMG coenzyme reductase, what is the consequence? Consequence is it increases LDL receptor. It is a compensatory mechanism. By the help of compensatory mechanism, the LDL receptor level number is increases. That leads to receptor mediated uptake of ideal intermediate density lipoprotein and LDL. ओके, ये आईडीएल एंड एलडीएल लेवल को हमारे ब्लड में कम कर देता है. ठीक है. Now one of the important class of drug is for the treatment of hyperlipoproteinemia. So it's one of the important drug is atorvastatin. Okay. One important thing is you have to know that this HMG coenzyme reductase activity is maximum. The HMG coenzyme reductase activity is maximum in midnight. मिडनाइट में कोलेस्ट्रॉल सिंथेसिस ज्यादा होता है. दैट्स व्हाई these statins are given at bedtime. Okay. And one important thing is all statins are metabolized by CYP3A4 except rosuvastatin. These points are very much important point you have to remember. Okay. The important, we will discuss important drug, that is atorvastatin. This is a statin having additional antioxidant property that helps in treating atherosclerosis. Okay. It reduces LDL cholesterol in highest intensity. Okay. So what are these major adverse effects? Adverse effects are GI complications, then muscle issue, or we can call it as myopathy. Destruction of muscle is maximum. It is a typical side effect of this class of the drug, and I will discuss some drug interaction about myopathy. Okay, sometimes serum transaminase level get high, level may increases. Okay, so coming to about myopathy. Myopathy is the one of the important side effect or typical side effect of statin. So what happened? This leads to destruction of muscles. So this myopathy is maximum. This myopathy is maximum when you combine this statins with nicotinic acid. When you combine statin with nicotinic acid or gemfibrozil or any CYP3A4 enzyme inhibitor. लाइक कौन सा आता है CYP3 एंजाइम इनहिबिटर में? लाइक कीटोकोनाजोल, साइमेटिडिन, okay, such type of inhibitors are not combined with statins. That this statin, if this combined, the myopathy is maximum. Okay, so coming towards its uses. So coming towards its uses, it is the drug of choice in primary hyperlipidemia. So what is primary hyperlipidemia? Let us know. So lipidemia is basically of two type. Okay, जो hyperlipoproteinemia है, it is basically of two type, primary and secondary. Secondary is associated with some disease like diabetes. That is a particular region, diabetes, myxedema coma, nephrotic syndrome, oral contraceptives, drugs. Some of the drugs can causes hypolipidemia like oral contraceptives, beta blockers, steroids like corticosteroid, then chronic alcoholism. Okay, again this primary of two types, due to single gene factor or due to multiple gene factor. Okay, so the statins are the drug of choice in primary hypolipidemia. Okay, next important class of drug is bile acid sequestrants. These are the resins. What they basically do, binds to bile acid and interfere in enterohepatic circulation. Okay, what happens due to this? The bile salts and cholesterol excretion, bile salt and cholesterol excretion increases. Increases. These are helpful in atherosclerosis, but having some side effects like decreases the absorption of other drugs, GI complications. Then next important class is lipoprotein lipase activator. Lipoprotein lipase is an enzyme. What it basically do is it converts VLDL into triglycerides, circulating triglycerides. Lipoprotein lipase convert VLDL into circulating triglycerides. Lipoprotein lipase activated by PPAR alpha. Is peroxisome proliferator activated receptor alpha. That is peroxisome proliferator activated receptor alpha. Okay, this PPAR alpha activate the lipoprotein lipase activation This PPAR alpha also helps in acid oxidation. It also helps in fatty acid oxidation. Okay. PPAR alpha also another function, that is increases LDL receptor expression in liver. LDL receptor का expression liver में increase करता है. So it ultimately leads the triglyceride level. Okay. So these are class of the drug fibrates. Basically triglyceride lowering agent. These are basically triglyceride lowering agent. Okay. So these are the one of the important class that decreases the triglyceride level. So if we'll discuss about gemfibrozil, it is a fibric acid derivatives, effectively lowers the triglyceride level by breakdown and suppressing of the hepatic synthesis of the triglyceride. So these are basically given in type 3 hyperlipidemia. टाइप 3 हाइपरलिपिडेमिया में हम बेसिकली इसको प्रेस्क्राइब करते हैं. ओके. सो इट्स absorbed orally and metabolized by glucuronide. Metabolized by glucuronide conjugation. Okay. THAP is around 1 to 2 hours. Okay. So basic dose is around 600 mg BD taken during bedtime. Okay. So bench fibrate, it is a second generation PPAR alpha activator. Okay, that can given in type 3, 4, 5 hyperlipidemia. Okay. Then coming to the next important class of drug, that is nicotinic acid. It is a vitamin. It is the one agent, the only agent that increases the LDL receptor. LDL level, HDL, it increases the HDL level, high density lipoprotein level. It is the only agent which increases the high density lipoprotein. Nicotinic acid is a B complex vitamin, that is B3. At higher doses, it increases the HDL level. Okay. Along with the HDL level, and this is maximum increases. Along with the HDL level, it also decreases VLDL and triglyceride. Triglyceride and VLDL level also decreases. Okay. So one of the this receptor, this it act on GI type of G protein coupled receptor. It is also one important question. Okay. Then its adverse effect is very much important. As it is used in a large dose, it is act as a basically a large dose. It act as a cutaneous vasodilator. Okay, and we know that due to vasodilation, flushing is there. So flushing is the important side effect of nicotinic acid. So to treat this flushing, we can give two important drugs. One is aspirin, another one is laropritant. Okay, so basically this flushing is due to generation of PGD2. Okay, due to generation of PGD2, and aspirin. Laropritant is a specific drug. It is a specific drug that used in nicotinic acid induced flushing. So this is when question asked what is the drug of choice in lipoprotein induced vasodilation, is lipoprotein induced drug of choice. The drug of choice will be laropritant. Okay. Other side effect includes dyspepsia. Okay. Hyperpigmentation. Dyspepsia, hyperpigmentation, then liver dysfunction, hyperuricemia, hyperglycemia. Okay, so these are the important side effect. A question basically asked from this region, that is what are the side effect of nicotinic acid as a hypolipidemic drug. So you have to remember. Okay, it is so coming to its uses. Used in type 3, 4, 5 type of hyperlipidemia. It is also used to reduce the plasma triglyceride level. It is the important drug in control pancreatitis. Initially I told you hypolipidemia basically two types, atherosclerosis and pancreatitis. So pancreatitis associated with hypertriglyceridemia, associated hypertriglyceridemia. You have to remember this is the important class of drug that used in this particular condition. Okay, you have to remember. And you know that as it is a cutaneous vasodilator, what important drug interaction you can see? The important drug interaction C is postural hypertension. When combined with antihypertensive. I will tell you how this occurs, because you know that these antihypertensive class of drug basically causes vasodilation. So when there is a already vasodilation is there, that agonistic vasodilation that can lead to postural hypertension. Okay, and the risk of myopathy, and another important interaction is the risk of myopathy, that I have discussed here, that is risk of myopathy increases when it combines with statin class of drugs. Okay, then the last class of drug is dietary cholesterol absorption inhibitor or dietary sterol inhibitor. What it is do? It basically inhibit NPC1L1 in intestine, specifically intestinal mucosa. इंटेस्टिनल म्यूकोजा में ये NPC1L1 करता है, इनिबिट करता है. What this NPC1L1 helps? This basically helps in absorption of dietary and biliary cholesterol. As it helps in absorption, if we will inhibit, the ultimate absorption will be reduces and the total cholesterol will be reduces. So due to that, there is a compensatory mechanism. You know that we in our body there are always a compensatory mechanism for each and every class. So by the help of compensatory mechanism, the LDL cholesterol level increases. So to counteract this, we have to give low dose of statin. So basically the conclusion we found that when we give a diet inhibitor, absorption inhibitor, we have to give low dose of statin. So drug is ezetimibe. Question directly asked, which drug comes under dietary cholesterol synthesis inhibitor, absorption inhibitor, that is ezetimibe. Dietary cholesterol synthesis inhibitor, that is ezetimibe. Okay, so its absorption is very poor due to its poor aqueous solubility. Okay, so T-half is around 22 hours. T-half is around 22 hours. Okay, so basically we combine sterol absorption inhibitor with low dose of statin class of drug. Okay, so last class is not is one protein, that is CETP, cholesterol transfer protein. What it basically do is it exchange cholesterol ester with triglyceride. CH stand for cholesterol ester with triglyceride. So if we, and due to due to this disposal of HDL associated cholesterol takes place. So we can inhibit this protein. So this class of protein inhibitor are, just remember the name, torsetaprib, anacetrapib, torsetaprib, anacetrapib. So this is the two important class of drug that inhibit CETP, the CETP cholesterol transferase protein. So we have completed the topic hypolipidemic drugs. Thank you. We'll meet with the next video on another topic. Till then, bye bye.